Hello, hi, I'm Dr. Wayne Sutton. I've been practicing dentistry here in Roanoke Park, California, Northern California in our beautiful wine country now for a little over 15 years. Dentures are an opportunity in my mind to do a full makeover for someone. And I'm not talking about just to make a smile great, but actually rebuild facial structure, to re-support the lips and the cheeks and the vertical bite. The nose and chin sometimes look like they're coming together, and that can age someone, unbelievably age them, 10 to 15 years. And by making a proper set of Fountain of Youth dentures is what we use. They're essentially a facelift product that's just a gorgeous denture. The teeth are beautiful now, and again, they're set in such a way that they're perfectly imperfect, right? We want these to be a little bit more on the natural side. But yeah, it's hard to tell what's a denture and what's a veneer case in my office if you see the photographs. There are some dentures around on the website and on the walls that you would think are maybe porcelain teeth. So when it comes to time for a patient to address the fact that they need all of their teeth either removed or that they're an existing patient with dentures, most often I find patients with the lower full denture suffer the most. They have an issue with the denture staying put. It rubs around, it doesn't stay in the mouth, affects speech and chewing. It's really tough to live with. That's one of the hardest things I think for patients to live with is a lower denture. And thank God we have implant dentistry, because this is a solution for that. Whether it be choosing an option where we're doing many implants to stabilize the denture, or ultimately the best option would be to do an implant placement such that we can actually permanently screw the teeth in so they don't have to come out again. Talk about life-changing. That's life-changing. Patients that are dealing with a loose denture or problem dentures or sore spots, you can eliminate that with implants. It's really exciting. So we have a number of different ways we can go with denture patients and help them out. The first one, of course, would be to just make a properly made, properly fitting denture without any implants. And certainly that's a step up for a lot of folks that are dealing with a problem denture. The next best option after that would be to consider, at the very minimum, at least 2 implants in the bottom jaw, because then you're snapping in, like a snap-on tool, it clicks into the implants. Still not as secure as more implants, but certainly much better. We might go from 10 to 15% function, meaning chewing ability, and with just 2 implants, we can bring that up to 50 or 60% of normal. So that's an excellent investment for patients to consider, just 2. If the budget's there and they want to go all the way, man, it's great to go more. If you can go 5, we can screw in permanent teeth, and it's unbelievable what we can go from there. It's really undistinguishable from natural teeth at that point. One of the exciting things with implant dentistry that we learned, and we started learning this probably 20 years ago, and now we know it's a fact, is that bone will continue to deteriorate without any kind of stimulation in the bone itself. That happens if ever you've lost a tooth, or anyone you know has lost a tooth, the jawbone gets skinnier because there's no tooth there anymore. With implants, what the exciting thing is when you put implants in the jawbone, it stimulates the bone around the implants and the bone remains. So you can save your jawbone with implants. That's what I'm getting at. It's really not only excellent for function, and you can screw down teeth and they hold, but now you're saving jawbone because you put implants in. Vibrations down the implants transmit to the bone cells, and the bone cells stay thick and grow stronger. One excellent point to bring up is, in fact, if nothing's done about any implants or anything with the denture, the bone will continue to shrink away. And through the years, there's some nerves, some special nerves down here called mental nerves. And as the bone shrinks, that nerve actually comes closer to the surface. So if you're wearing a denture on there, you can imagine the pressure on a nerve is a problem. It can hurt. By having implants and saving that bone, you can stop and actually reverse that process where the bone shrinks away. So loose dentures, putting pressure on bone, causes bone to go away much quicker. And if you have implants, you can save all that bone. You can prevent that from happening. If there's a patient, for example, that has had dentures in for 10 to 15 or even 20 years or more, and they haven't thought about what we can do nowadays with denture, it's a new world out there. We have teeth now that look like human teeth. They have 3 different layers inside of them. There's translucent effects on the edges. The custom colorization that we can do with the pink color of the denture rivals nature. these are, again, the artists behind this kind of work, and I only work with the very finest denture technicians in the world on these cases, and so you can see the difference. Just, you can look at some of the cases that we have on the website, or you'll see, if you see people, you know when there's an old denture in it, and you can make these things so lifelike now, and they fit better. They process so that they actually fit tighter. They look better, and they look natural.